A human being can survive almost anything as long as she sees the end in sight. But depression is so insidious and it compounds daily that it's impossible to ever see the end. This quote by Elizabeth Wurtzel and its accurate way to describe depression for many people may resonate with you. I'm Dr. Kristie Overstreet, psychotherapist and clinical sexologist. I'm here with Mad Men Marketing to help you learn a little bit more about the feelings you may be experiencing, especially if you're feeling depressed or something similar. Today, I want to cover a couple of things: the different types of depression, how it looks different in each person, and then some tips on how to treat it. So let's start by talking about what depression actually is. There are many ways, symptoms that might show up in your life, emotional and physical. You may have an outlook that feels hopeless. Major depression is a mood disorder that affects people and it affects how they see themselves. Having a helpless or a hopeless outlook on your life is one of the most common symptoms of depression. Other feelings you might be experiencing are worthlessness, self-hate, inappropriate guilt, or reoccurring thoughts of feeling bad and depressed. Another thing you may experience is a loss of interest. And depression can take away the things that we find pleasure and enjoyment in. A loss of interest in things you used to do or things that you want to do, or you feeling so tired that you can't bring yourself to enjoy these, such as maybe it's a sport, activity, hobby, or even spending time with friends. Another area that you might lose interest in if you're feeling depressed is in sex. Symptoms of major depression include a decreased sex drive and maybe even impotence if you're experiencing that. Another common symptom is increased fatigue and sleep problems. Part of the reason that you might have stopped enjoying doing the things that you used to is because you feel so tired. And with depression comes a lack of energy and overwhelming feeling of fatigue, so much that it might feel debilitating. And this is going to cause you to sleep more. But depression is also linked with insomnia, and as one might lead to the other or vice versa, they can make each other worse. The lack of quality restful sleep can lead to even more anxiety as well. Next is that anxiety, which might be a symptom you experience. So we know that depression doesn't cause anxiety, but these two conditions can occur together. So I want to share a couple of symptoms of anxiety specifically. It might look like nervousness, feeling restless, or feeling very tense. Maybe you're feeling dread, panic, or even the sense of danger ahead. Rapid heartbeat, rapid breathing, increased or heavy sweating. And a really common one is that difficulty focusing and not being able to think very clearly. So if you're experiencing those, it's maybe anxiety and also maybe accompanying depression. Another symptom that might be happening is a change in weight or a change in appetite. This fluctuates when people are feeling depressed, and it's different for each person. Some people are going to feel an increase in appetite and see a weight gain, while others won't have a sense of appetite. They'll lose their sense of hunger and they'll lose weight. And one indication of whether this dietary change is happening in depression is if you're intentional about it or not. And if not, it might mean that you've got some depression going on, meaning you're not trying to not eat or you're not trying to lose weight. Another symptom you might be experiencing is uncontrollable emotions. Example is 1 minute you might have an outburst of anger, the next you might be crying uncontrollably. Noting outside of this change, your emotions are up and down, and at any moment you can feel anything. So depression can cause mood swings in many people. Now I want to tell you about a couple of different types of depression, the 6 that I'm going to cover. Each of these are very different, and it's important that you know that there are different criteria that diagnoses each of these, and you need to see a licensed health professional in order to come up with a diagnosis. So for this video, I'm just going to explain a little bit about each of them and some of the effects that it's having. Major depressive disorder is a common one. It's estimated that 16.2 million adults in the US have had at least one major depressive episode in any given year. The second one is persistent depressive disorder. You might have a single bout of major depression, or you can have recurrent episodes. This persistent depressive disorder is also known as dysthymia. It's chronic low-level depression that's lower in severity than major depression, and it lasts about 2 years or longer. It's these ongoing feelings of deep sadness and hopelessness, in addition to the other symptoms such as low energy and decision, that happens in about 1.5% of US adults in a given year. It's more prevalent in women than men, and at least half of all cases are considered serious. A third type of depression that's out there is bipolar. This type is also known as manic depressive disorder and affects 2.8% of the US population in a given year. It occurs equally in men and women, while 83% of cases are considered severe. It's a large amount of people. This disorder involves the development of a manic or energized mood. Sometimes these may be preceded or followed by episodes of depression. The presence of these episodes is what determines the type of bipolar disorder that's happening, because they are different types. The fourth type is seasonal depression. If you have major depressive disorder with seasonal patterns, also known as seasonal affective disorder, your mood is affected by the seasonal changes. This occurs in about 5% of the US population in any given year. And it's good to know that this is triggered by the onset of autumn or even lasts throughout the winter. It very rarely occurs in summer and spring. Geography and distance from the equator does play a significant role in this disorder, and women also represent 4 out of 5 people with this condition. The fifth one I want to share with you is postpartum depression. This is a big one that I know we don't talk enough about. As much as 80% of new mothers experience these baby blues, and the symptom includes mood swings, sadness, and fatigue. These feelings usually pass within a couple of weeks. Think about that, 80% of new moms. That's only 20% that aren't experiencing this. So it's extremely common. It's caused by hormonal changes following childbirth, the lack of sleep, and the pressures of taking care of a new baby. When these symptoms, they persist longer than a couple of weeks, and if the severity escalates, it may be a sign of major depressive disorder with peripartum onset, also known as postpartum depression, which is different. Additional symptoms might look like withdrawal, lack of appetite, and a negative train of thoughts. And according to the American Psychological Association, about 10 to 15% of US women have a depressive episode within 3 months of childbirth. And 1 in 5 new moms experience minor depressive episodes, and as many as 10% of new fathers may experience this condition too. So it's important to know that both parents can experience this, but it looks different in each of them. The sixth and final type of depression that I'm going to discuss here is psychotic depression. When major depression or bipolar disorder are accompanied by hallucinations, delusions, or paranoia, it's called major depressive disorder with psychotic features. So as you hear these 6 that I just covered, they look different from one another, but then in each person, it can look totally different. And even though depression affects millions of people, we do see some commonalities, but there's so many variations. And it's not always going to look obvious to you or even those around you of what that depression may be showing up like. Some people experience high functioning depression, meaning that they have depression, but they can maintain their everyday and sometimes exceptionally tasks can be maintained. Owen Wilson, Charles Schultz, that created the Peanuts, Winston Churchill, Emily Dickinson. These are just a couple of examples of people that have suffered from depression, but still maintain every day. And many others can't maintain their daily activities and suffer depending on the severity. Know that sadness and that feeling of being sad and depression are different. Think about sadness as a typical emotion and expected in situations of loss, change, transition, or difficult life experiences you might be going through. Depression, though, is this condition that exists without triggers and can linger to the point of needing treatment. It's more occasional than sadness. Depression also involves a period of hopelessness, lethargy, feeling empty, irritable, and problems focusing and concentrating. Some people describe it as this dark cloud that follows them, or feeling like they're running in water, not being able to get anywhere. There's different ways that it looks in each person. So keep that in mind. And what can happen is, if you're not careful, you can compare yourself, because you may know someone else is depressed or dealing with depression, and they're able to do things in a different way. Don't do this, because it does look different for each person. So let's go through some tips. Let's start out with, if you know someone or you've got a loved one that's depressed, don't tell them to just get over it or to just snap out of it. This does not work. It's important that you know that thinking positive and having happy, positive thoughts does not cure depression. Know that therapy can help a person identify their negative thoughts, their beliefs, and their habits that might be contributing to depression. So talking it out with someone you trust, someone that knows you, someone that you can feel safe with will help. For some individuals, medication is a route they may want to consider. You can talk with your health care provider about this. There's so much stigma behind mental health. So if you're experiencing any of this, do not hesitate to tell your doctor. Also, learning mindfulness skills and practicing gratitude can help with depression. The type of food you eat could definitely affect it. Increase in vegetables and proteins may be helpful versus high carb foods. Spending time with others, even when you don't feel like it. It's okay to take solo time and be alone, but make sure you're at least getting around other people at some point to help take a little bit of focus off of you and maybe help them out. That will kind of pull you out of that space you're in. Another good tip to consider is volunteer work, getting involved in a cause, or giving back. Again, this helps you get out of what you're experiencing and helps you focus on something else, which can help. Exercise, daily walk, getting moving, having activity. This can also help your mental state from feeling this physiological impact on your body. Getting sunlight every day, getting outside. It doesn't mean you have to lay out and get a suntan, but just getting outside a couple minutes a day and get some sun on your skin to help re-energize you can help. And as you know, I'm going to reiterate again, that importance of talking to somebody, anybody. If you can't face it, call a crisis line. One of the fear many people have is, if I reach out to a crisis line, are they going to try to put me in a hospital or lock me away? No, they won't. Okay. So go ahead, reach out, share, whether it's in a Facebook group, whether it's a crisis line, whether it's a therapist, counselor, spiritual advisor, loved one, friend, just talk to somebody. Because if you don't, you continue that stigma of that there's something wrong with you if you have mental health issues. And we want to break that by talking about it more. I really hope you're going to start rethinking how you see and view depression. And remember again that it looks different on everybody. So until next time, keep taking care of yourself and moving forward with focusing on your mental health so that you can keep creating your best life.